My name is Michael Lundeen. I am 27 years old and I'm applying for the DNP FNP program at Weber State University. I'm applying to gain the knowledge and education to be a competent and proficient nurse practitioner. My goal currently is to work in the PICU at Primary Children's as a nurse practitioner. That's where I currently work, so I'm excited to advance my career in the same setting, hopefully. We'll see how that goes. Work aside, I like to work on cars, I like to purchase cars, just everything about cars is fun. I like to travel. I'm currently a travel nurse, actually, still at primaries, but yeah, long story. But I like pickleball, and I have a dog and 2 cats, which are great to be around. So I recently got married to my husband, Walker. He is also applying to nursing school, but just RN. He is applying to Davis Tech. So it'd be cool to work in the same field and both go to Weber State. Who knows where we'll be in a few years. So back to career. I worked in the PICU for 4 or 5 years-ish. So the reason I actually worked there is because I heard that they had a really good education system. They train you for 6 months and you just learn a lot. So that's the whole reason I went there, and I learned a lot there, and I still work there. So it's great. They really prepare you for graduate school. It's rigorous, honestly. So I'm excited to continue. So to describe the program I'm applying for, it's going to be the DNP FNP program for 2024 fall. I am applying to not only just better myself, but I like learning about the human body. So it's nice to expand my knowledge on the human body and just go more in depth on a graduate level versus undergrad level. This will also open more doors to a more, I feel like, stable career, because I'm currently a travel nurse and there's always that stress of, am I going to have a job in a few months? But being an NP will be great because I feel like it's a middle ground between MD and RN, where you still get a lot of bedside, but you also have the role of a practitioner and provider, so you get to kind of live both worlds and whatnot. So I'm just really excited to be starting school again. So some of my strengths are I love learning, if that wasn't apparent already. So I feel like I'm very knowledgeable and thorough in most things. So like at work, for example, whenever there's anything new or somebody asks me, I like to jump in. I'm usually like a yes man, I guess you could say. So basically I like to orient people. I like to learn new things. I just always jump in to gain knowledge in my current setting. So basically being in the ICU also, so not only learning, but I think being willing to learn, but also being thorough about it. So like in the ICU, you have to be very thorough to keep your patients safe because they're all intensive care. So I think me being thorough is going to be beneficial for being a practitioner. So on that, I'm also very adaptable. I feel like I could work in any setting. I say I want to work in the PICU, but I also could see myself working in a clinic or even aesthetics, just depending on where I go. But that's why I like this program, because you can kind of do anything. So they all intrigue me a lot. I feel like I'm very ambitious. I always try to improve myself, hence applying to graduate school. I just feel like it's the next step from bachelor's. After a few years, you just get the itch to learn more. So this will help with that. The DNP program, benefits my global community by, so working in the PICU, you deal with a lot of intense situations, and it's always good to promote a healthy environment. So I think it'll be good to use my nursing knowledge and practitioner knowledge that I will be gaining as an NP to just better the pediatric community, specifically critically ill children, doing research to better outcomes from them. Currently, the NPs that I talk to, they all have research hours, which I'm looking forward to. I think it'll be cool. They have clinical plus research hours in their work week, and it'll just be good to better myself and the community around me by doing that research, whether it be there or wherever I work. That is me, and I'm excited to start the program in the fall if you accept me.